ever, an increasing number of people are reaching out for mental health support, but there is a lack of resources here in Wisconsin.
And some patients who have the coverage to get the support they need are now being turned away. Jamie Perez spoke to a woman who says she was abruptly told she would no longer receive services from Journey Mental Health. And Jamie joins us now with how this may affect you if you are a Medicare patient, Jamie.
Sure. So the woman that I spoke with, actually, she speaks for a lot of others who are also Medicare patients who are too afraid to speak up about what they're dealing with. Now, with that said, she asked to be kept anonymous for privacy concerns, but she shared her experience about being turned away from the mental health services that she was getting.
If I don't get the outpatient services to support me, I end up in a hospital.
This woman who agreed to interview with us said she was abruptly turned away from Journey Mental Health Center services. To keep her anonymous, we'll just call her Cara. Cara deals with PTSD, bipolarism, and anxiety. She's been with Journey for the past 5 years, but said last month she was cut off from their services.
All Medicare patients were being discontinued at Journey, and I asked effective when. She says today.
Cara said she's been without therapy for a month now, something she said she needs on a weekly basis. We asked Journey Mental Health Center's chief clinical officer about this.
It is not a standard practice that a consumer would show up and be told that day that they're going to have a final session. So whenever an individual, again, has a change in their insurance carrier, we will work with them and we will transition them.
But Cara said there was no change in her insurance.
I feel abandoned. It's really a scary feeling that I'm left out there alone.
Letman Shu said there's several reasons why Medicare patients may see this happening with Journey.
We have some of the lower Medicaid and Medicare rates in the United States, and so oftentimes people are put in a position where they are looking at making ends meet, and so they have to limit how many Medicare and Medicaid consumers that they can see.
Journey should have their patients' health in mind versus their pocketbook.
Cara said her prescriber for these meds she got through Journey gave her a 3-month supply to bridge the gap so she could have time to find a new provider. But Letman Shu agrees that this is not an easy task for those who are turned away.
Oftentimes that can take weeks or months. If it's about a medication change, our doctors will oftentimes bridge their medication until they can get in to see another prescriber.
There's a severe psychiatrist shortage here in Madison. Plus, there's a lot of psychiatrists that won't take Medicare.
In the meantime, Cara said she's speaking on behalf of others who may be facing the same struggle in finding someone to help. Cara's hoping she can find a way to make it back to Journey.
I'd love to go back to Journey. I have made so much progress in the last 5 years.
If you are a Medicare patient dealing with similar struggles in seeking mental health services, Letman Shu said she is trying to make the transition as easy as possible for patients to find a provider who will take your insurance. In the meantime, you can also lean on NAMI of Dane County. They do not provide clinical services, but they will provide you with the resources to get the help that you need.
All right, very, very important story. Jamie Perez reporting. Jamie, thank you.